Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then shoulder dislocation. In the shoulder dislocation, we have three types of shoulder dislocation. Okay, we have anterior shoulder dislocation, which is most common type involving around 90 to 95%. We have posterior shoulder dislocation, which is involved in only 1 to 3 to 4% is seen. It includes the posterior shoulder dislocation. Then we also have inferior shoulder dislocation, are also called as luxatio erecta. So this inferior shoulder dislocation or luxatio erecta involves only 1 to 2% of patients are in inferior shoulder dislocation. Now anterior shoulder dislocation, the defect in anterior shoulder dislocation is abduction with external rotation is seen in the patients with anterior shoulder dislocation. The hand is in abduction and external rotation. The position of the joint, not the defect, actually position of the joint is in abduction and external rotation in anterior shoulder dislocation, whereas in posterior shoulder dislocation the position of the joint is in adduction with internal rotation. Okay, then the position of the joint in inferior shoulder dislocation is actually it is in hyperabduction position. Okay, now what are the causes of these three? Okay, so first in the anterior shoulder dislocation causes, it is mainly occurs due to the vigorous throwing of the ball can result in anterior shoulder dislocation. Then we have the posterior shoulder dislocation. Posterior shoulder dislocation can occur because of the following conditions. Actually, anterior shoulder dislocation, it is actually very painful because of vigorous throwing of the ball. The patient develops highly painful lesion, which is anterior shoulder dislocation, whereas posterior shoulder dislocation are all ease. So it can occur in conditions like epilepsy and electrical shock. Okay, it can occur in epilepsy, electrical shock, electric bull sign and empty glenoid sign. So it is seen in electrical bull sign and empty glenoid sign is associated with this posterior dislocation. So if you see, this posterior dislocation is actually a painless or minimally painful lesion is seen. All these will result in painless conditions or minimally painful conditions. So this is posterior dislocation. Then we have inferior dislocation occurs whenever the person is saluting. So in salute posture, the inferior dislocation can result in uh, can result in in salute position the patient can have inferior dislocation. So this is painful. So these are the types of the shoulder dislocation.
thank you and thank you for watching.